talking about a common but often overlooked issue, paronychia, or inflammation around the nail fold. This can happen on both your fingernails and toenails. We'll cover what causes it and how to treat it. George has been feeling extra nervous lately, so he has been biting his nails more than usual. Stop it, George!
It's Doctora Victoria and George.
Paronychia is an infection that affects the skin around the nail, usually when the nail fold is damaged from things like nail biting, picking at hangnails, or even from too much moisture. There are two types, acute and chronic. Acute paronychia usually happens quickly after a minor injury, like a cut near the nail. It's often caused by bacteria like Staphylococcus aureus. Chronic paronychia happens when the nail fold is irritated over time, like wet work or constant hand washing. For acute paronychia, we want to reduce the swelling and fight the infection. There's some things that you can do. You want to start by soaking the affected nail in warm soapy water for about 10 to 15 minutes a few times a day. This helps to reduce swelling and discomfort. After soaking, you can apply a topical antibiotic ointment like mupirocin to fight the infection. For more severe cases, oral antibiotics may be needed. If there's an abscess, meaning pus buildup, your healthcare provider may need to make a small cut to drain it. Now, for chronic paronychia, this is trickier. It's caused by repeated irritation, so avoiding triggers is key. Moisture is a common culprit, so make sure you dry your hands thoroughly after washing and wear gloves for any wet work. For chronic cases or long-term cases, we recommend using a high-potency topical corticosteroid, which can reduce inflammation. Topical means we use a cream, and this is different from something called systemic, where we would take medicine by mouth, which would bring medicine to all your body. This will most likely need a prescription from your doctor. Even if you try over-the-counter creams, know that steroids will work better than antifungal medicines will for this. Preventing paronychia is all about keeping your nails healthy. You want to avoid biting your nails or picking at your cuticles. That means you, George. You want to keep your hands dry and wear gloves if you're doing a lot of washing or dishwashing. So bust out some rubber gloves when doing the dishes. If you work with chemicals or frequently wash your hands, make sure to moisturize afterward. Anyone who uses hand sanitizer regularly should make sure that they're moisturizing regularly too. Thank you for joining us today, our healthcare team. Paronychia can be uncomfortable, but it is a very treatable condition if you know the right steps to take. If you have any questions, leave them in the comments below, and don't forget to subscribe and hit the bell to be notified. Thank you for joining us today, our healthcare team. We hope that you'll join us next time. Bye-bye.